huge shoe collection. I'm like, Jaden, why do you want all these stinky shoes in your room?
I just have that extra chair. You can have a seat there, but I'm going to be bouncing back and forth.
We're fine.
All right. Your date of birth.
8/30/35.
I'm going to see Dr. Bergeron today. When did you see Dr. Simonton?
2 days ago.
Okay.
That's not true.
When does him?
Last.
The 22nd or the 21st? Last week sometime?
Last week, last Wednesday.
Okay.
The 20th.
Do you wear glasses?
No.
Okay.
To read.
Gotcha.
March the 20th, she saw Dr. Simon.
Okay, so it was last week. I'm going to have you hold this up for me right on your nose. Can you see any letters up there?
Yes.
What can you make out for me?
NCKZO. RHSDK.
Good.
DOVHR. CZRHS. ONHRC. ODKSNV. ZSOKN. OKDNR.
Good. How about down here?
It's a little bit hard. That's
That's fine.
hard.
No, you don't have to apologize. I'm just seeing where you can go to. Give me 1 second here.
It's really small.
Yeah. Gonna have you look through the little holes right on your nose.
Oh my.
Can you see this line down here?
Yes, it's CKDNR.
How about the next one?
I think it's BRZKD.
How about the next one?
I'm going to take a guess. That was hard.
Okay.
HT, whatever, I don't know.
Not a problem. You did great. Okay. Let's take a look at your left eye. Hold on 1 second. What can you make out up there?
1, 2, 3, 4, the fifth line. ONHRC. DKSNV.
Good.
ZSOKN.
Good.
CKONR, I think.
Right. Let's try you with the little holes on that eye.
Oh.
Can you see the line down here?
Yeah, I think so. That's a CKDNR.
How about the next one?
That one's hard. SNJKD.
Okay. Missed a couple of them. Not too bad, though. Look straight ahead. Let me take a look at your pupils. And follow my pen with your eyes. Good. Cover your left eye with your hand. Can you see a dot?
Yeah, it's right in the middle.
Look at the dot. Do the lines look straight, wavy, or distorted?
You're straight.
Okay, cover your right eye. Can you see a dot?
Yes, in the middle.
Do the lines look straight, wavy, or distorted?
You're straight.
Okay. Cover your left eye again. You're going to look straight at me. How many fingers?
2, 1, 5, 1,
Cover your right eye. Same thing. Look at me.
3, 1, 2, 5.
You got it. Here comes some eye drops.
Really burn?
Possibly, if her eyes are dry.
Okay.
Look up. Just keep them closed for a minute. You okay?
Mhm.
Uncross your legs for me. Look straight ahead. Keep both eyes open. Make sure you breathe. This is the glaucoma test.
Sorry.
Wipe your eyes for me. Both eyes open. Can't get up. I have to get some of those finger pressures for me. Can't get up there right. I'll be right back.
No, sure.
Gotta get some of the
Hello. Ricky's gonna check for us. Gloves are right there.
Okay, look straight ahead. Oh, 10.
Okay.
13.
Okay. Thank you. All right. Those are good. The dilating drops. Sometimes somebody else has the magic touch. Look up for me. These instruments, some of them are very temperamental. All right. Have you had any eye surgeries or procedures over the years?
No.
No cataract surgery?
No.
Yes,
No,
she
I
had,
did.
she had her right cataract removed on July 12th, 2023.
Hold on one
Probably-
second. One at a time here.
Okay.
Which eye was first?
Right cataract, July 12th, 2023.
Okay.
And left
Hold on one second. Who did the cataract surgery?
Dr. Jason Simonton
No, the back.
and Dr. Judah Beck. They were both there. They were-
was it left eye?
August 30th, 2023.
Okay.
The same two doctors, Dr. Simonton, Dr. Judah Beck actually did the operation, but they were.
Okay, I just need to know who did the surgery. So it was Dr. Beck.
Dr. Beck did
Okay.
the actual surgery.
And that was August
August 30th,
30th.
July 12th, and August 30th for the left eye.
And she was just in the hospital because they found that like a blockage.
Okay, we'll get to that in a second. Right
Okay.
now is I'm just trying to get the cataract stuff in.
Okay.
Alrighty. And did we have a stroke?
Yes, an
Okay.
acute behind her right eye.
Okay.
I didn't know you could have something like that.
Yep. And when was that?
The 20th of March is when it was diagnosed.
Just, okay. Any other medical conditions that you've been diagnosed with?
Recent-
Cancer, thyroid, blood pressure?
In totality or recently?
Oh, over the years.
Oh, she had bladder cancer.
Okay. And did they do treatment?
Yes, and that's 2012, and that's been gone.
What kind of treatments did she get?
I believe they scraped her and
I
they
think
removed
so.
it all.
Yeah. Yeah, I'm fine.
She had a
Alright.
pig valve put in her heart
Okay.
on August the 3rd, 2015 by Dr. Way.
I don't need the
WTO.
doctors, I just need the information and the date. I don't have places to put that stuff. August 3rd or when?
August 3rd, 2015. She's been fine with that.
Anything else?
That's all I know of.
Alright. Do we get a flu shot?
Not yet, no.
Did you get one last season?
I usually don't.
Okay. Any family history of cancer?
No.
Okay. Any family history of diabetes?
Yes, my grandmother.
On which side?
My mother's.
Okay. Glaucoma in the family?
Not that I know. No.
Macular degeneration?
No.
Have you ever smoked cigarettes?
Yes, I did. I quit about 15, 20 years ago.
Okay.
My kids made me. They weren't happy.
Alright. Are you at risk for falling?
No.
Do you drink any alcohol?
No.
Any caffeine, coffee, tea, soda?
Coffee.
How many cups a day?
Yeah, probably about 5 or 6 at least.
Okay.
That I like. I'm drinking water too. More now.
Okay. You're not a diabetic, correct?
No.
Okay. And medications that you take.
Yes.
Do you have a
Yes.
list or do you know what you take?
I don't have a list, and I know some of the ones I take, yes.
Okay, what do you take? What's the first one?
I have to think about the money.
Mhm.
Furosemide.
No.
No, she doesn't take water pill anymore.
I have
She
to
takes amlodipine. I'm not pronouncing these right.
You're fine.
Simvastatin.
Hold on 1 second.
Did you have a list in your purse? You should.
Never thought of it.
You should have it in there.
I should.
Omeprazole.
You sure? Okay.
Next one.
Simvastatin,
I got that one.
omeprazole, cetrizine,
Hold on 1 second. So is that the allergy pill?
yeah, cetrizine.
Where's my beanie?
Low dose aspirin.
Furosemide.
No, you don't take that anymore.
Oh, that's
They
right.
take you off the water pill.
I think I have it.
And so that.
Anything else that you can?
No, just omeprazole, simvastatin.
Oh, you Purinol? Oh, you Purinol? Don't take that anymore?
Metapropyl tartrate.
Okay.
That's all. Just going through the numbers, that's all.
I don't think I have a list, honey. I haven't found it.
You should have a list.
I should? No, I haven't found it.
Are you allergic to any medications?
No, not that I know of. What is in here? Oh, I forgot I had his picture. Oh boy. That's it, there's nothing else.
Are you noticing changes? Having trouble with your vision?
No,
Okay. Any floaters?
no,
Any flashes of light?
no,
Having any eye pain?
no, not at all.
Any distortions? Do things look wavy or anything?
No, not at all.
Dr. Simonton did show us on the computer she does have floaters. She said she doesn't see them,
That's possible.
but he
Yep.
did that. He did say she does.
Yeah, that does. That is, I've heard that before. The doctors can see it, but the patient doesn't see them. And they can come and go. They might come in times that she's not, not realizing that she saw them or anything.
Huh?
The list of medicine is it is.
You sure?
Mm-hmm.
This is what we're looking for?
Preservation. I know there was one more. But that wasn't a prescription.
She's on preservation.
Yes, she is. She is. Twice a day.
Gotcha.
If it's here, I don't know where it would be. Okay, found it.
I think I got one.
We can always get them if you have to come back. Just bring the list with
I
you
don't
next
think
time.
this is on there.
I think that's it.
All right, you guys are gonna follow me.
Guess I better be. It is a question, but it's not really a question.
Take care. We're gonna get a quick scan and then you guys will see the doctor.
Patient over here. As, what's that expression, as per usual?
Okay.
I'm David, I'll get your scans. Give me a minute to set this up for you. So since I'm a Pittsburgher, should I say, how are yins doing?
Yeah.
Scan doesn't take long. Um, so you've had a lot of fun with that right eye, it says here.
Yes.
Okay.
Of course, I really didn't notice it that much.
So, P-E-Z-I-C-H.
Pesach, yes.
Alrighty. I've learned the hard way to, the first time I put a name in, double check and make sure it's spelled right. And I'm sure you can figure out that the reason I said that is because I made a mistake once, didn't catch it. You know, you gotta fix it in 7 different places after it's in the system. Much less work to do it right the first time. Come on. It doesn't listen to me, but it makes me feel better to tell the computer to hurry up. I'm usually up in Cranberry, and one time it was going real slow,
Oh.
and the Cranberry's not open today, and we'll switch around. And the computer was going real slow, and I told the patient, I'm just waiting on the boss. And she smiled. Did you marry your computer? That was the best. All
But
right.
that's far. I mean, yeah, that's far you come. Yeah, because country is far from here.
Cranberry's not open, and we have 2 doctors here and a lot of patients. So if we can get more staff, you know, or they don't force you to take a day off, which is even better, I guess. So you bear with me. I got to get this at a
Okay.
decent height for you. I don't know if
Okay.
that chair is even high enough, but we'll get you here. Okay, try that. I think I have to raise your chair. I'm going to ask you to hold a little lower there, because that moves your chin. Try that. Bear with me. Oh, sorry. I apologize. Is that okay for a minute or two? Okay, you bear with me. I know it's not perfect. I'll do this real quick. I'm going to ask you to look for a blue light in there, if you can see it.
With one eye?
No, it's with your right eye. There. That's perfect. Okay, blink whenever you need. Bear with me here. Get this lined up and focused. Perfect. Get used to a slightly different machine, you know. This is actually a better one. It has more controls. But you get so used to the one that sort of is the automatic instead of the stick shift. Let's get a second one here. Blink a few times. Good. Right at that light in the middle, if you can see it. That's perfect. Just like that. Very good. Very good.
I'm looking at you, sir. I'm not by the, I was looking at you.
Okay, let's start over. You can't talk in the middle of the scan, and I'm not criticizing you. I'm laughing with you. No, whatever you're, okay, you don't see the blue light in there? Because the first one you were
I
looking
was on
at.
the side and I was looking at you. I didn't
Okay.
see the light. That's
Okay,
why I mentioned
I'm
it.
sorry. See, the first one you were looking just fine, so please hold lower. There, okay, you hang in there. All right, I understand. So just look straight ahead or look at my big nose or something. That's fine. Right there, bear with me. Good. Right there if you can, that's perfect. Just bear with my directions here. Oh, let's forget about that. And there. We're going to show them. Please look for that light in front of your left eye. Okay? That one I'm moving. You see that one? There. Hang in there. Follow that up a little, please. Do you see that light with your left eye?
I see that. Yeah,
Right there.
yes,
You
I
said
see
you
it.
didn't see the blue, so I'm making your left eye do all the work. Is that okay?
Yes.
Great. All right, you hang in there. Good. You bear with me. Let me get it lined up. Good. See, you fooled me on the first one. You did that. That was so easy that I got spoiled. There. Just like that. Like that, please.
So I was right through the
Please don't talk during the scan.
I'm sorry.
It messes it up. Okay, right there. You got it. Perfect. Very good. Great. Now, I have to do one more on this side. So I'm going to move that light over. Okay. Please follow that over a little bit. There. It's a little tricky. And please follow it up.
Mary Kay.
And blink a few times. Excellent. Great job. Right there if you can.
We're going right in.
Perfect.
You
Right
can
there.
set your things in that chair and you get the chair in the corner.
Good. Sorry the instructions are so tricky.
No, it's
When you're
okay.
doing the scans on the eye that doesn't see it well, it's never as easy as back in there. We'll get a couple on your other eye. That's Murphy's Law. There's that running joke. Well, it's simple if you see 20/20. We don't see too many of those. They wouldn't be here. if
No,
they didn't.
no.
All right,
I'm
champ.
surprised.
Right in the center if you can see that light. So how well can you see it? I'm not lined up yet. There. Right there.
The red light?
Now okay, first of all, I said that wrong. Do you see a blue light in the middle or not?
I do, but it's moving, yeah.
Okay, that's what I thought.
Okay.
Well, right there is good enough the way you're looking. That's perfect. Hold that, blink whenever you need. Very good. Bear with me. Hang in there. Good. Good. 2 more and we're done. I know you want a few hundred, but you just need 2 more. Okay? Blink again. Right there in the middle. Perfect. Just like you're doing. And one more scan. I'm going to ask you to follow that light off to the right. It might look like it's on my face or my nose.
Yeah, the blue light.
Look for the blue one. That's it. That's perfect. Bear with me. Blink again. Good. There we go. Good. Sit back. You did it.
It didn't move.
Sorry that was so tricky, but I could see your left eye was moving just a little bit, so I knew that was jumping around on you. But we got it. So hang in there. I love how it says, please wait, as if I have a choice.
Yeah.
Well, it's certain lights.
You can see, you can actually see, you know how I see it by looking at that?
Well, you said that you weren't able to stay perfectly with the light on your right eye. So that's why I went with another trick up my sleeve. Now, when I went to the left eye, now that's your better eye, isn't it? Your left eye?
I guess so.
Okay,
I have,
but you were moving around slightly, not physically. We got perfect scans, but you said that blue light was jumping a little bit. So that's why if you're not looking like way around the room, if you move just a little bit, the machine just follows you. But if you're looking up way all over the place, it can't. But if you just slightly bit you're moving, it's going to follow you. It'll move the skin with you, which to me is one of the best things it does. Okay, Excuse the hiccups. How was your drive over? You're not exactly next door.
No,
I guess
far.
you would have been in Cranberry if it was open today.
Yeah.
Yeah, we have a doctor on vacation, at least one of them, so it kind of.
That was far from, from where we live.
Yeah, well, I'm in Ohio Township. It's a little bit of a hike for me to get here, but not horrible. It's
No.
just the drivers on the park there, they're all more than the miles.
Yes. The roads are very well traveled.
Normally, I get on at Mount Nebo Road and come up 79, and it's not far.
Where are you located in Cranberry?
The easiest way to say it is, you know where Walmart is up there?
Yes, I do.
You cross 19 from Walmart. There's a little one-block road called Short Street, where the Monroe or whatever the oil change place. You turn left and then right as if you're going into Planet Fitness, and we're behind Planet Fitness.
Okay.
You know where it is?
At the end of the road. My daughter lived out there.
And I'll never forget that intersection because about 6 years ago I got T-boned by somebody running a red light. You know, I'm very lucky. I mean, all 4 side airbags went off and I didn't get a scratch. Almost. 2 little things. Now, it's funny, you can laugh or not, but the worst thing about it, it was one of our patients that hit me. But he wasn't in the office that day. He just never stopped for the red light. He didn't realize it. And sadly, I looked him up every now and then. 2 years later, he died of Alzheimer's. So it had already started, you know. So you know what a patient said to me, the dirty dog? I told her, she says, Dave, did he know it was you? The dirty dog.
Yeah.
That's pretty funny, but thanks a lot. Did he know it was you? What did he hit me? But yeah, I looked like I